I am Linda Johnston and I'm Dean of the Lawrence S. Bloomberg Faculty of Nursing. Welcome to Bloomberg Nursing's 4th annual Verna Huffman Splane Lecture, an event possible through the generosity of the Richard Splane and the Splane family. Before we begin, I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to live and work here and to benefit from the resources and freedoms that were forcibly taken away from the traditional owners who still struggle to access land, clean water, healthcare, education, equal human rights and freedoms. There needs to be more recognition of Indigenous battles against climate change and a centering of the Indigenous viewpoints and voices in these movements. Indigenous and Northern communities face many challenges, including managing the impacts of a changing climate. This includes impacts on health, addressing the high and often fluctuating costs of energy, and promoting sustainable development that balances consideration of environmental, social and economic well-being. Indigenous and Northern communities in Canada are particularly vulnerable because of factors such as remoteness and inaccessibility, the cold climate, ageing and inefficient infrastructure, and a reliance on diesel for electricity generation and space heating. A little bit about Verna Splane. Throughout her career, Verna Huffman Splane concentrated on national and international health, policy development, and the extended role of the nurse. After receiving her diploma in public health nursing from the School of Nursing at the University of Toronto, she went on to become Canada's first Chief Nursing Officer, a role she served until 1972. Verna was a staunch advocate for public health, and as many of you know, climate change and its impact on the health of our population is of great concern. I'm delighted to see so many of you here for this important and timely discussion around nurses and their leadership in the face of our current climate crisis. Many of our Bloomberg nursing faculty are members of the University of Toronto's Sustainable Community of Practice, a group of healthcare professionals, scholars and researchers who strive to educate healthcare professionals about the ways in which they can promote sustainability in their practice. Just recently, we have witnessed the urgent call for leadership at the COP26 summit in Glasgow as the world seeks more concrete ways to mitigate our climate crisis. And at this year's International Council of Nurses Congress, former UN Secretary General Ban Ki-moon spoke of the integral role of the nurse in helping to achieve global sustainable development goals. Today, I'm pleased to welcome our keynote speaker, Professor Ruth Schofield, who is an advocate for public health and climate sustainability in her own right and a leader in national nursing education. Ruth is an assistant clinical professor at McMaster University and an experienced educator in community health nursing curriculum development, implementation and evaluation. She has over 23 years of public health nursing experience in frontline and management positions and has held a variety of leadership positions, including as chair or general member on several provincial and national boards, and most recently as a member on the Canadian Association of Schools of Nursing Accreditation Bureau and the Canadian Association of Schools of Nursing Community Health Education Interest Group. Ruth is also one of the co-creators of the Canadian Association of Schools of Nursing Climate-Driven Vector-Borne Diseases Guidelines and e-resource. From Lyme disease to malaria, the risk from vector-borne diseases are increasing as environmental temperatures continue to rise. In today's talk, Ruth will discuss the impact of this online resource and the unique knowledge it provides to the next generation of healthcare professionals. She will also focus on how nurses can take the lead in addressing the impacts of climate change as they continue to care for their local and global communities. Thank you very much, Ruth.
Thanks, Linda. It is indeed an honor to speak at this Verna Huffman Splane lecture. And as Dean Linda Johnston mentioned, the topic, my topic is on leadership, nursing leadership in the age of climate action, health impacts of vector-borne infectious diseases. Next slide. And the learning outcomes for this presentation are to examine the relevance of climate-driven vector-borne infectious diseases and explain the nursing roles in addressing and responding to climate-driven vector-borne infectious diseases. Next slide. There's clear evidence that climate change is a serious threat to the health of people across the lifespan. And Linda alluded to this, and I'll develop that further. The United Nations identifies shifting weather patterns as the defining issue of our time and emphasizes the world has reached a turning point moment in history. Without immediate drastic action, weather patterns will have catastrophic consequences in the future. Our response to climate change is considered the greatest health opportunity of this century. Climate change places diverse populations such as Indigenous, as noted, children, low-income groups, and people with chronic conditions at greater risk. In 2014, the Government of Canada released a national report on the impact of climate on health in this country. The report concluded that higher temperatures have been lengthening the transmission season of vector-borne diseases and expanding the geographic range. Nurses, as the largest health professional group in Canada, have an important role and leadership to play in addressing and responding to these health challenges related to climate change. Furthermore, as was noted earlier already, the International Council of Nurses has called upon the profession to participate in actions to mitigate the impact of climate change, and in particular, to address its effects on populations with a greater vulnerability to disease. Next slide. Given the relevance of climate change and vector-borne infectious diseases to the current and future nursing profession, in 2018, Canadian Association of Schools of Nursing, or COSN, was funded by Public Health Agency of Canada to conduct a 30-month project titled Empowering the Next Generation Healthcare Professional with Knowledge, Skills, Tools, and Supports to address infectious diseases related to climate change in Canada. The purpose of the project was twofold: to increase the knowledge of climate-driven infectious diseases on population health among nurse educators, and to foster the integration of this knowledge into nursing education programs. The two deliverables were a national evidence-based education guidelines on climate-driven vector-borne infectious diseases for nursing education. And the second deliverable was online modules that would accompany this education guidelines and serve as an educational toolkit in climate-driven vector-borne infectious diseases in Canada. Next slide. So the Climate-Driven Infectious Diseases, or CDID, committee had a broad representation across schools of nursing in Canada, Canadian Nurses Association, Canadian Indigenous Nurses Association, Community Health Nurses of Canada, public health units and organizations, Medical Officers of Health, Association of Medical Microbiology and Infectious Disease Canada, Public Health Agency of Canada, and COSN. So quite an extensive, broad representation. Next slide. Vector-borne infectious diseases from viruses, bacteria, and parasites are transmitted by ticks, and mosquitoes, or as been described, vectors, spreading disease from animals or insects to human. Mosquitoes carry infectious agents that cause diseases of malaria, West Nile virus, and Zika. Lyme disease is transmitted by a deer tick that carries a bacteria. Lyme disease is the most common tick-borne disease in Canada. The most health endangering endemic mosquito-borne disease in Canada is West Nile virus. West Nile virus is transmitted from bird to human through a mosquito bite. The majority of vector-borne diseases, like malaria and Zika, that are transmitted also by mosquitoes, at this point are not established in Canada due to our harsh winter weathers. Environmental change related to warm health in Canada is increasing the risk of Lyme disease and West Nile virus. Next slide. The evidence of climate change and health stresses the reality of the growing burden on the lives of people and consequently our healthcare system. We know that climate change is increasing across Canada. We're seeing that in floods and wildfires. We can see that wildfires in Alberta and BC, and now in Ontario, we heard this summer, and the higher surface temperatures. We know insects depend on consistent climate for survival and reproduction. When climate changes, vector distribution and burden of illness increase. In 2019, the Canada Communicable Disease Report indicated that climate change will likely drive the emergence of vector-borne diseases, including tick-borne diseases and endemic exotic mosquito-borne diseases such as Lyme disease, West Nile, and possibly malaria and dengue. These are also noted. They are also noted that risk will be compounded with aging populations affected by chronic conditions, resulting in greater sensitivity and vulnerability. Recent facts on Lyme disease indicate that in 2019, the rate of Lyme disease was per 100,000 was 7.9, and the rate per 100,000 of West Nile was 0.2, but it included 2 deaths. In Ontario, the risk areas of Lyme disease in 2021, were identified in the Windsor-Essex County area of the GTA area and along the Eastern Ontario area. So right along the Great Lakes, you could say, when you look at the map. When comparing Lyme disease across Canada in 2016, the rate, now that's 2016, recognizing that that is not current. But at that time, the rate per 1,000 of Lyme disease in Nova Scotia was 34.4, the highest. Manitoba was 3.9, and Ontario and PEI were 2.7. So we, at that time in 2016, were third. But as you can see, 2019, we'd already moved to 7.9. So quite a clear indication of the rising rate of Lyme disease in Ontario. Next slide. A number of determinants of health influence individuals, families, communities, and populations, resulting in a greater risk of vector-borne diseases. We did identify age was a factor earlier. And there is some evidence that childbearing women with Lyme disease are at risk for miscarriages, newborn defects, and birth defects. Climate change also poses a threat to social and emotional well-being and mental health of client population. In a systematic review by Mattingly Sherwolf, the greatest costs outside the healthcare system were associated with the health costs and productivity losses for persons with Lyme disease. Next slide. So what's been Canada's response? What has been or is Canada's response? In 2015, Canada ratified the Paris Agreement, as we've been hearing about as of late, with the commitment to reduce emissions of gas. In 2016, this resulted in the development of the Pan-Canadian Framework on Clean Growth and Climate Change. And then in 2019, the Canadian Public Health Association identified climate change as a public health emergency and has called on federal government to work with provinces and territories to take action in legislation, regulation on gas emissions, and the health of Canadians. As we know, the current, as was mentioned by Linda, COP26, the United Nations Climate Change Conference, has affirmed Canada's commitment once again to continue and increase mitigation targets for reduction in emissions with a target of 2030. Next slide. So what is public health accountability? Though I do recognize in this slide mostly Ontario, many of the standards being considered related to climate-driven infectious diseases are also current in other provinces and territories. However, in Ontario, public health policy defines climate change and vector-borne infectious diseases in two program standards: healthy environment and infectious diseases. In the Healthy Environment Program Standard, public health is required to conduct surveillance of environmental factors like climate change and for epidemiological analysis for trends and monitoring of priority populations by identifying risk factors and priority health needs, assess health impacts, and collaborate with other sectors. In the Infectious Disease Program Standard, if vector-borne infectious diseases is determined to be significant based on a number of factors, the public health unit's goal is to reduce the burden of this infectious disease using multiple strategies such as reporting, public education on personal prevention measures, and vector control programs. As we know, Public Health in Ontario also provides relevant information on best practices and data on vector-borne diseases. Next slide. Known to some, or maybe all of you, is this graphic representation of One Health concept that nicely provides a visual image of the relationship of relevant concepts associated with vector-borne infectious diseases. It represents the linkage among human, animals or insects, and the ecosystem health domains, and is an intersectoral approach to prevent and respond to complex public health threats at the animal or insect human ecosystem interface. The key themes of One Health involves prevention, detection, and response. And the concept encompasses economics, global action, culture, and social determinants of health. Applying One Health lens in zoonosis and vector-borne infectious diseases allows one to appreciate how the emergence, reemergence, and sustained transmission of disease is dependent on complex and evolving interaction between humans, insects, and animals, and the environment. Next slide. Turning now to nursing roles expected when working with vector-borne infectious diseases. One of the key areas of nursing leadership can be in health surveillance. Nurses need to apply epidemiological principles and knowledge about data, trends, and infectious diseases. Report health data for tracking and forecasting health events and health determinants. Integrate eco-social surveillance that focuses on broad, multi-level conditions that contribute to health inequities. Provide expertise to those who develop and or contribute to surveillance systems, including risk surveillance, and mobilize formal and/or informal networks to systematically and routinely collect health data. Moving on, next slide. Other nursing roles demonstrating also leadership include providing nursing responsibility related to these levels of prevention. Premortal prevention by identifying measures on the removal of risk factors of infectious diseases from existing, such as developing healthy public policies to create programs and services to prevent infectious diseases. One such example could be collaborating with relevant stakeholders in removing stagnant water to prevent mosquitoes from laying eggs. Using primary prevention strategies, nurses can promote routine checks, public education, and building capacity, considering the determinants of health. And also using secondary prevention strategies, nurses can lead in screening, early detection, investigation, early treatment, supportive care and case management, and advocacy for accessible diagnostic and treatment services for client populations facing inequities. And last, using tertiary prevention strategies, nurses can be leaders in providing services to reduce severity through education and monitoring effectiveness of treatment and identifying and referring for adverse effects. Next slide. Studies indicate that nurses lack knowledge of climate change. McDermott and Levy indicates that nurses have a significant role along with what was mentioned, mitigation, adaptation, and resilience to climate change, and concluded that educated nurses is critical to enable them to respond to climate change, which is congruent with this project. But what do our standards say? Or I should say, what's expected of entry-level nurses? So we're going to briefly look at the CNO entry to practice competencies that really pull out the level of knowledge, skills, abilities, and judgments in the development of the learning outcomes that inform the educational guideline that were important as we develop the content area. For example, entry-level nurses would have competence in the clinical role to be able to incorporate knowledge from epidemiological principles into the plans of care, and to use effective strategies to promote wellness, to prevent illness, and to minimize disease and injury in clients. And you can see the link to the nursing roles identified previously. In the advocate role, they would have competence to advocate for health equity for all, particularly vulnerable and/or diverse clients and populations, and to support environmental responsible practice, and to support healthy public policy and principles of social justice, to use knowledge of population health, determinants of health, primary health care, and health promotion to achieve health equity, and also in the advocate role, to use knowledge of health disparities and inequities to optimize health outcomes for all clients. And in the last role identified in the entry to practice competencies is the scholar role. And entry-level nurses would have competence to use knowledge about current and emerging community and global health care issues and trends to optimize client health outcomes, very relevant to this with climate-driven vector-borne infectious diseases. Hence, as you can see, several entry to practice competencies would enable our future nursing workforce to be prepared. Next slide. Adding to that, furthermore, not only enabling students to achieve the regulatory entry-level competencies related to these nursing roles, the COSN entry to practice public health competencies for undergraduate nursing education that were developed in 2014 provide further depth in the development of the knowledge, skills, abilities, and judgment to address and respond to climate-driven vector-borne infectious diseases. These competencies are to support the integration of current and relevant public health content like this in nursing education. 5 domains are identified with competence statements, and each statement has a number of accessible, measurable indicators. So the first domain is public health sciences in nursing practice, and and the competence is that students are able to apply public health sciences in nursing practice. And there are 6 indicators, of which includes those that apply to infectious diseases, and a number of the other content areas that are noted earlier. And the second domain, population and community health assessment and analysis, and this is all about a competence in assess and analysis, assess and analyze populations and community health using data, research, nursing knowledge, and considering the local and global context. And this has 5 indicators. Another domain is population health planning, implementation, and evaluation. And the competence is participates in planning, implementation, evaluation of one or more of the following. And it includes population health, injury prevention, and health protection programs with 3 indicators in this. And then a fourth domain is about partnership, collaboration, and advocacy. And the competence is that students are able to engage with partners to collaborate and advocate with the community to create, implement strategies that improve the health of populations with 3 indicators. And then the last domain in the public health competencies is communication and public health. And then the competence applies communication strategies to effectively work with clients, health professionals, and other sectors. And there's 4 indicators. Hence, you can see that the competency-based undergraduate nursing curricula provides a foundational preparation to address and respond to climate-driven, vector-borne infectious diseases. Next slide. So guided by these nursing roles and these competencies for entry-level nurses for the education guidelines, the CDID committee first conducted an environmental scan. The environmental scan included a scoping review and a national stakeholder forum with multiple sectors such as nursing education, nursing regulation, nursing employers, practicing nurses, public health organizations, government, nursing students, and persons with lived experience of vector-borne infectious diseases. These 2 methods informed the first draft of the educational guidelines to reach national consensus, a national validation survey using a modified Delphi approach, and further consultation with gender and Indigenous experts were conducted. The results of the survey found all learning outcome statements, except 2 were supported as important and essential. The 2 remaining were considered for graduate level and were deleted. The educational guidelines underwent another in-depth, gender-informed Indigenous review. Next slide. The educational guideline framework was organized into 5 domains with accompanying learning outcomes. The first domain was public health, vector-borne infectious disease with 13 learning outcomes. The second domain was populations exposed to potential risks with 5 learning outcomes. The third was prevention, which included primary and secondary, with 5 learning outcomes. And the fourth domain was treatment, focused on tertiary prevention with 4 learning outcomes. And the last domain was advocacy with 7 learning outcomes. A learning outcome expresses the lasting changes that must arise in the learner during and following an education experience. These learning outcomes clarify what must be learned in a course or program, offer direction for the selection of learning activities, and provide benchmarks for the assessment of learning. The intent of these guidelines provide targets for graduates, baccalaureate nursing programs in Canada to achieve in the area of climate-driven, vector-borne infectious diseases. The guideline provides an extensive glossary. Next slide. The second deliverable that I'd mentioned earlier was an e-resource to facilitate and foster the integration of the health effects of climate change and vector-borne infectious diseases in schools of nursing. The goal of this e-resource was to support the integration of the learning outcomes within educational guidelines into entry-level nursing curricula, to provide faculty, students, and practicing nurses with information, teaching and learning material, and tools. And lastly, to impart the knowledge and skills to help build nursing capacity to work with populations at risk or affected with climate-driven vector-borne infectious diseases. The target audience for this e-resource was not only for faculty and students in undergraduate nursing education, but also nurses in practice and other health professionals. The advisory committee identified guiding themes to inform the development of this e-resource, such as the importance of interprofessional and intersectoral collaborative practice, respectful acknowledgement of the lived experience of people with vector-borne infectious diseases and Indigenous peoples, sensitivity of language, and multiple ways of knowing. Next slide. So the e-resource is organized in also 5 modules to align with the learning outcomes. The 5 modules, the first one is nurses engaging with the environment. So it's about climate change and health. The second module is about nursing practice and vector-borne infectious diseases. The third module is about primary and secondary prevention of vector-borne infectious diseases. The fourth is tertiary prevention. And the fifth is about advocacy, awareness and advocacy. These standalone modules support an interactive and dynamic learning approach, including case studies, self-assessment quizzes, virtual client scenarios, and an annotated reference list. It is estimated that each module is about 2 hours and can be completed in any order. The 5 modules are part of a larger e-resource toolkit of ready-to-use teaching learning tools, including fact sheets, an infographic, module synopsis, and lists of existing resources. Next slide. A website called, and you can see you can access it here, is called Nursing and Climate-Driven Vector-Borne Infectious Diseases. And this is right on the COSIN website. And this was developed, as you can see, for educators, students, and professionals. The content provides evidence-based information to empower individual or nurses, whether students or in practice, to be leaders in addressing climate-driven vector-borne infectious diseases. A unique section on the website is called Living with a Climate-Driven Vector-Borne Disease. In this section, there are a number of testimonials of people with Lyme disease. A significant learning for many of the advisory committee members was hearing these stories, recognizing their strengths and incredible challenges faced, especially within our healthcare system. These stories highlight the critical importance of client advocacy and leadership in shaping policy, programs, and practices addressing climate-driven vector-borne infectious diseases. Many resources are included on the website with links to several Lyme disease advocacy groups across Canada, with podcasts and documentaries. Next slide. I just want to end this presentation and to share this story.
Brooke has hockey at 6:30. Brad's at 7:45.
It seems like a normal day talking about upcoming activities for his 3 young kids. But Mark Boychuk and his family's sense of normal fell apart in June of 2017 when his wife Lindsay started to feel sick.
Dizzy, and then all of a sudden, really sensitive to hear. And then after that, the anxiety started, to be as bad as you're getting chased by a bear.
At times, she was suicidal. So for 14 months, Lindsay Boychuk was treated for postpartum depression. She saw a doctor, psychologist, psychiatrist, naturopath, had 20 rounds of electroshock therapy and drugs. Nothing worked. A US doctor suggested testing for Lyme disease. When the Manitoba test came back negative, the Boychuks paid for 4 independent tests in the US and Germany. They all came back positive for neurological Lyme disease, leaving the family frustrated about testing here.
We're miles behind where we have to be. If we don't even have a test that can even pick it up, we got a long way to go.
While doctors started treatment in Manitoba, the family says things got worse. Mark took video of his wife having a seizure to show doctors.
Okay, deep breath.
Since June, Lindsay has been at the Spinago Wellness Clinic in Florida that specializes in treating Lyme disease. When we visited him, Mark was getting ready to see her, and the strain of being apart was taking its toll.
Pretty excited. It's been a month.
The emotional burden is made worse by the financial one. Testing, treatment, travel, and everything else has so far cost $250,000. By the time this round of treatment is complete, the total could double to $500,000. Friends set up a GoFundMe page to help the family.
We've sold, all our trucks, boats, quads, snowmobiles, all our assets, and the house is going to be up for sale right now as well. So you got to do what you got to do.
As it stands right now, Lindsay's treatment in the U.S. is not covered by Manitoba Health. Her doctors here in Manitoba, including a specialist in Lyme disease, have all submitted these letters of support to change that. The Boychuks are still waiting to hear back. When we reached Lindsay in Florida, she said she is finally starting to feel better. She also said her friends and family have been lifesavers.
I'm so grateful and thankful. I feel this overwhelming, tremendous sense of gratitude for my family, my friends, and all of my support systems that have been there for me and have watched me struggle so severely. It means the world to me.
A world that has been rocked, but still has room for hope. She'll get better and back home with her family again. Eleanor Koop-Sammy, CBC News, Winnipeg.
Thanks. If we can move to the next slide. And those were some of the stories that we heard that were just so powerful when we had a stakeholder meeting and we had people living with Lyme disease joining us. So I just wanted to share some of the stories that we heard. So in conclusion, the COSIN guideline for undergraduate nursing education on climate-driven vector-borne infectious diseases and its accompanying e-resource provides increased knowledge of climate-driven vector-borne infectious diseases on populations' health among nurse educators and fosters the integration of this knowledge into nursing education and provides us an excellent resource to move forward as leaders in addressing this. I just want to end in the next slide with an interesting quote. Believe it or not, back in 2008, very dated, but wow, powerful. If we are to limit the impact of emerging Lyme disease on human health in Canada, the appropriate public health messages and clinical information must be issued to the public and medical health practitioners and targeted to the right risk locations. Next slide. So I just want to thank you and for this opportunity to share some of this work and providing us the opportunity as nurses to really advance our knowledge and understanding in this very, very critical health emergency that we're facing within Canada. And so the next slide, lots of resources or references if you want to have them. So moving on to the last slide, I would be more than welcome any questions, comments, and so I'll leave it to my colleagues to open this up.
Thank you, Ruth, for a very interesting presentation. Really appreciate you taking the time. The presentation is now open for questions. People can use the chat. To Cindy, to your point, we can share, I think, Shauna, the link to the PowerPoint afterwards via email. If people have questions, Shauna, do you want hand raising or just in the chat?
Yeah, so first I'll start by saying as long as Ruth's okay with it, we will send a post-event email with her slides and the recording and a survey to fill out. So stay tuned. And yeah, I think everyone feel free to raise your hand and turn on your mic, and you can ask a question or include it in the chat box.
Maybe while people are thinking about questions, Ruth, I'll take the liberty as MC to ask you something, which is, you know, I noted you had, excuse me, domains of advocacy and awareness within the frameworks. And how do we not only educate our students regarding climate change and vector-borne diseases in particular, but engaging them in advocacy roles? Do you have some advice or want to provide some insight onto the advocacy piece of the framework that you referred to?
Yeah, we really saw that this was a very critical part of nursing education, because many students have a perspective of advocacy at an individual level, which is critical in this case as well, especially if individuals are experiencing Lyme disease. But if you're looking at a population level, the skills involved with working with communities, we really wanted to emphasize was part of it as well. When we're seeing communities or client populations, what are those capacities they need in not only being aware of this and aware of their needs of the community, but how do they actually advocate with other sectors? And this is a whole new area of knowledge and skill capacity that we saw was critical for them to start thinking about. Yeah, we need to talk to veterinarians. Yeah, we need to talk with other sectors, work with communities. And I think this is where obviously with the Indigenous population, we can learn so much in working with communities and that whole community development. So it was really building on that we thought was critical in that particular domain and competence or learning outcomes that would be in the curriculum. Thanks. And be it through, and we've got in the e-resource a number of examples where faculty and students can pull out looking at case studies that really help them to critically think about ways that they can write letters or collaborating with various key stakeholders to address areas, whatever. But there's multiple strategies and very practical tools that are available for faculty to guide that learning.
Thanks, Ruth. There is a question from Pamela in the chat. What are some of the actual initiatives you have seen public health nurses engaging in that are having an impact on this frightening problem?
Very good question. And frankly, right now, probably none. As we face the pandemic, obviously it's not a priority. However, what I have seen is there is, as we well know, public health has a strong role with families and with young children. And so there's lots of opportunity with parenting groups and in schools, especially in our area in terms of public education, really informing parents, children around checking daily if they're outside playing. So that whole tick check And there's some really neat resources out there that children can learn to check as well. And so that is an area that we're certainly seeing, and we need to see more of that the public embrace that. But certainly in terms of public health nursing roles, those are areas that very much I've seen and heard public health nurses being involved with. Those are just a couple of examples, but I'm sure if there's other public health nurses on, they may have some other ideas that would be helpful to share.
Thank you. Thank you. While we're waiting for other questions to come in, you know, Ruth, I noted in my land acknowledgement the particular impact that climate change is having on our Indigenous peoples, Inuit and Métis, First Nations, etc. And I noticed you referred to consultation with our Indigenous colleagues, etc., for their perspectives. Can you speak a little bit more about how vector-borne diseases are impacting, particularly within Indigenous communities?
Yeah, that's a very good question. And when we had our stakeholder forum, well, we clearly had some Indigenous people joining us because their voice was critical. The ones that attended, it was interesting. It depended where you lived. Some of them who live in the north at this point are not seeing it as part of they're just not seeing it because the risk is very low. They didn't talk about it much. However, if you're in our area, and we're in the DG area, that was a different story. And it was impacting them in the sense they're in the land, they're on the land, they get their foods from the land, and this was a growing issue. So that was what was critical for us to enable students and us as nurses to be sensitive to, that their exposure is in these infected areas is high. So how are we as nurses working with these communities to ensure that we have a common understanding of the risk associated with vector-borne infectious diseases? What are the health services that exist that would or not exist? And how can we advocate and support and work with them to ensure that there are resources available?
Thank you. Other questions for Ruth? Shauna, I don't see anybody's hands up of you.
I don't either.
Okay, then may I, in closing, thank you, Ruth, for sharing your innovative ideas with us here tonight. We all have a responsibility to advocate, to educate ourselves and our students and others regarding climate change, and in particular, the impact of vector-borne diseases and the increasing risk and its impact on people's health. Thank you all for joining us this evening. It's wonderful to be able to gather virtually, at least, and continue to connect with our Bloomberg nursing community. I invite you all to keep an eye on your emails, follow us on social media, and visit our website to stay up to date on upcoming events and offerings here at the school. And could you join with me in virtually thanking Ruth for an excellent present and informative presentation. Thank you, Ruth.
Well, thank you. It has been a pleasure. Thank you.